less than 15 seconds, and then we should not do a twisting technique if inserting this one to prevent any complications, might cause any bleeding. If we sense a restriction first, allow the patient to cough or even check if with a tongue depressor if we have, to know if the nasopharyngeal airway is being put in place, and then try to remove a little bit and then do it a little bit more, push a little bit more. So once you're done, we have to hyperoxygenate the patient, let the patient rest for a few seconds. If we want to do multiple attempts, make sure we will just do it not more than 3 times, and then assuming that we did everything and then we already obtained a specimen which was being put in between in here, which is called a mucus strap. We have to twist it with a hand, remove it carefully together with the sterile gloves, and dispose it to the proper waste disposal. So with the regulator, make sure you turn it off, and then make sure we already wash our hands and wear appropriate gloves, and then put it on this side, and then inspect also the oxygen device if it's functioning, especially with the bag, if it's still fully inflated or not, and then inspect also the patient, do our pulse assessment, our vital signs, and then make sure we auscultate it to know if there's still any breath sounds we've noticed inside the patient's lungs, and then we also have to know the SpO2 level. And then once everything's done, make sure in here we dispose it to the proper waste disposal with the PPE, also remove everything and then put also with a different proper waste disposal. And then if we already did our post assessment, once outside, chart everything, communicate with the staff or the physician, and